Good evening. My name is Dr. Ogechi Sylvia Eze. I am a general practitioner, which is a primary care physician in the United Kingdom, and I've been invited to give a brief teaching on depression. I want to thank Chinedu Neville for this opportunity, and I hope I would use these few minutes to give an overview on what depression is, how to identify it. That's more or less the symptoms. The symptoms are what the patient or what you begin to notice. The signs are what the clinician detects, and also what the treatment options are. I will start by saying that depression is a very common condition, more common than we think. And just the way people get physically ill, it's important for us to know that people can also get ill in the mind. So, depression is a form of mental illness, and it's important for us to talk about mental illness because there is still a lot of stigma and lack of understanding around it. We are quick to bandage a leg that is broken and bleeding, but we tend to overlook someone who is suffering from mental pain. I am coming from both a clinical perspective as well as a personal perspective. So I will define depression as a condition of persistent low mood, usually lasting from 6 weeks and above. It's good to know that depression is very different from sadness. Sadness is brief. It usually passes with time, and most times with sadness, there tends to be a trigger. Bereavement usually is when you've lost someone that you love and you are grieving that person. So there is also what you call the normal grief cycle, which is different from depression. Another reason why we should talk about depression is that depression is associated with a lot of morbidity. When we say morbidity, we're referring to illness burden, in that depression can affect a person's functioning. At the center of depression is the mind. When the mind becomes ill due to depression, the person loses the will to function. The person loses the will to go on, and this can affect the person's daily activities. It can affect their productivity at work. It can affect their relationships. You see friendships dissolving due to depression, marriages breaking up, people being sacked. Hence, it's important that people understand what these key features of depression are so that we can pick it early and offer people the treatment that they require. I'm making references to some of my notes. A good website to know more about depression is patient.co.uk. These are evidence-based studies that have been done. So, there are a set of symptoms that are associated with depression and help us to clarify the diagnosis. The core symptoms of depression include persistent low mood. This may be with or without a tendency to cry. A person stays and suddenly they burst into tears. They're constantly looking like there's a dark cloud following them about. They are constantly withdrawn. Secondly, there is a marked loss of interest or pleasure in activities. Somebody who is a chorister just stops coming for choir practice. Somebody who dances stops dancing. The one who is known in class to be the one to make other people laugh, suddenly they don't even come to class anymore. And also, so we talk about persistent low mood, loss of interest in pleasurable activities. In the clinical term for that is anhedonia. Also important to know that people have all sorts of thoughts of doom, and in worst case scenarios, suicidal thoughts. They begin as fleeting thoughts of suicide, and before you know it, the person wants to act on it. So when you as a friend or family notice these symptoms in your loved one, please sit them down, and ask questions. Let's not be afraid to ask questions because of what we will know. It's important that we find out exactly what is going on. So, other common symptoms of depression include poor sleep. Sometimes they sleep too much, or sometimes they have less sleep. Number four, change in appetite. Some people have very poor appetite, they begin to lose weight. Others eat too much, what you call comfort eating, and they put on weight. Then, tiredness, loss of energy. I want to sleep. I don't want to clean the room. Don't want to do my assignments. Sometimes they're agitated, always irritable, or there's slowness of movement. Poor concentration or indecisiveness. Are you coming with me to the cinema, or are you not? I don't know. That kind of, they just cannot make up their minds on what they want. And then you find them having feelings of worthlessness or excessive inappropriate guilt. They start remembering things that they did 10 years ago. Oh God, I cheated in my exam, my WAEC. Some people who are doing well, and they're just remembering all these things. You see, these are the persistent guilty thoughts that keep on coming into their minds. Then they have these recurrent thoughts of death. It's a preoccupation with death, telling themselves that life is not worth living, there's a better life elsewhere. And then once you find these out, maybe from the questions you've asked them, please, as soon as possible, let them be taken to see a doctor. There's no shame. The earlier these persons are diagnosed and managed, the better. So an episode of depression is diagnosed if you have 5 out of the 9 symptoms which I mentioned above, with at least one of the core symptoms. And then if these symptoms distress this person to the point that they cannot function, also if these symptoms are occurring at least every day for 2 weeks or more, it's also good to rule out any other biological cause of depression. For example, when patients come with tiredness, sleeping, as a clinician, I would want to investigate. So I finished taking my history from the symptoms you've given me. I'll examine these patients. Do they look tired? Do they look pale? And then I want to investigate. Could it be due to anemia? People who have lost blood, maybe from heavy periods or from poor diet, they feel quite tired. And also metabolic imbalances like an underactive thyroid can make a person become quite tired and lethargic. Also low vitamin D, which is not quite common in our part of the world, unlike what you see in the West where they lack sunshine. Things like low calcium, low magnesium, and then you also want to rule out the effects of alcohol and drugs. So once I have made that clear diagnosis, I've taken the history, I've done all the blood tests and nothing abnormal comes up, I make a clear diagnosis of depression. This person has felt like this for at least a month and going forward. I want to talk about management. It's good to know not all types of depression need treatment. There is a questionnaire called the PHQ-9 that we administer to patients. The PHQ-9 scores the patients on the severity of their symptoms. Depending on the severity, we classify depression into mild, moderate, and severe. Like I said before, the severe depression is the one that is crippling this patient so much they cannot function, and they are so preoccupied with ending their lives. Most times they've made plans or they've had previous suicide attempts. This is the depression that we do not, we try to refer as quickly as possible to the specialists who are the psychiatrists. So for mild depression, these patients can be managed with counseling, psychotherapy, talking therapy, family therapy. This is where the family has to come in, lots of encouragement, lots of love, lots of words of affirmation. If you pray, that's a good time to hold hands, to come together and let this person feel loved. So that is counseling, talking therapies, family therapy. Moderate depression, in this case, we have to use a combination of both talking therapies and medication. There are various types of medication used for depression. Your doctor will discuss that with you. The most common medication used is what we call a selective serotonin reuptake inhibitor. Some of us would have heard about it, for example, fluoxetine, which goes by the brand name of Prozac. Usually, when we start patients on antidepressants, we tell them that it might make them a bit more agitated. It might make them to have more or stronger thoughts of wanting to harm themselves. And in this case, we tend to put patients on a short course and tell the family to please monitor them closely and then bring them back to the clinic in about 2 weeks' time to find out how they're doing. For severe depression, for these patients, we want to do what we call a suicide risk assessment. And it's important for us as loved ones and families of people with depression to always ask, how do you feel about living? Are you having any thoughts of wanting to harm yourself? Have you made any plans? Because it will surprise you that some people have got weapons and have hidden them. The mind of people is so powerful, and we really don't know what people are up to. So it's good to find this out, and if there is any indication that this patient is planning to take their lives, medical help must be sought immediately. In these patients, we tend to start them on antidepressants immediately. In some cases, the patients will need urgent admission and monitoring in a safe environment. So I've talked about depression. What are the causes of depression? The causes of depression are multifactorial. It could be genetic. If somebody in your family has had depression, then there's a chance that we are at risk of it. And it's good to know this so that we can take steps to prevent it. So genetic causes, stress, stress at work, stress in the family, lack of purpose in life. Big factor currently is the coronavirus pandemic. Schools are closed. People have been laid off work. There doesn't seem to be any future or any hope. And it's that lack of being in control. And then you feel like, what's the need? Is this life really worth living? And all these thoughts of worthlessness begin to find roots, and people start having thoughts of, I don't want to live anymore. So stress, lack of purpose, trauma. People who have been assaulted, physical assault, sexual assault, verbal assault, traumatic childhoods. Sometimes these memories come back and play on our minds and engender that feeling of worthlessness. Also, biological causes of depression. For example, people who have vitamin D deficiency tend to feel quite depressed. You could also get a bit of depression with underactive thyroid, and then pregnancy and also in the postpartum. So yes, I've talked about biological causes, genetic causes, trauma, stress. What are the things we can do to prevent or manage depression? Because the good news is depression is treatable. It is manageable. It's important to talk. When you feel this low mood is coming, speak to family. It's always good to have a trusted friend that you can speak to and say, this is how I feel. If you've got access to counseling services online, or your religious leaders, please speak to them. Secondly, exercise. Exercise is so good in that when we exercise, we improve blood flow to the brain. We release the feel-good hormones, which are called serotonins, the dopamines. Yes, and they help us feel better. I also say find the motivation to do those things you love. Most times, whenever I feel myself getting down, I try to find those things I love. Singing, I love to sing. Listening to music, dancing, going out into the sun, going to see something new. These are things that will stimulate our brain and distract us from those dark thoughts that are coming. It's also a good practice to practice gratitude. A friend of mine, Dr. Omon, who is a life coach, always says, write down 3 things every day before you go to bed. Write down 3 things you're grateful for. When we focus on those things that we have, and we practice gratitude for those things, we gradually find out that there are things to be happy for and things to be grateful for. Gratitude banishes these thoughts of worthlessness. Also, being able to count how far we've come. I know that right now, with most of us being at home, being out of job, we just wonder, is it really worth it? It could also be the time to try and learn a hobby, learn something new, and also for us to try and cultivate positive thoughts. Somebody said positive thoughts are those flowers that we plant in our minds that keep the garden of our minds beautiful and blooming. When these negative thoughts come, we try to turn them around. Instead of saying, because I failed an exam, I'm worthless, we can say, that's a failed attempt, I will try again. And it's also good for us to remember that these will pass. I've been there before several times. And when you're in there, you feel like, oh God, this is the worst time of my life. I don't think I'll ever be happy again. I don't think I'll ever smile again. Let's remember, it will pass. We will feel happier. We'll feel better with ourselves. So yeah, this is a brief video on depression. I'm trying to summarize what it is, the signs, the symptoms, the management, the causes, how we can prevent it. So Chinedu will be putting this video on the group, and then we can have a further discussion on Microsoft Teams. I hope to catch up with us all on Microsoft. Take care, and I pray 2021 is better than 2020 was to us. Have a lovely week.